You talk about quality of life improvement and giving a percentage, and I recently saw close to where I live a commercial saying, come to our hospital, we have 98% survival rate with these two cancers. And it was a TV commercial and that's all it said. So when people hear that, they think, great, I'm going to go there, although it doesn't say what survival rate is, how long that is, quality of life, things like that. So when people are trying to find solutions to a cancer that they have, how do they know where to look when you see things like that it maybe is a little bit more deceiving than at first glance?
That's right, because they didn't even say what type of cancer, right, Scott? So it could have been, was it?
I think it said like a head and neck,
wow.
and they left it at that. So again, yes, open to a lot of things.
Right. Head and neck cancers are notoriously one of the most aggressive type cancers, right? So in general, first of all, cancer is very seldom a medical emergency. Right, so if someone is diagnosed, it's not like they have to rush and have the chemo, the surgery, or the radiation therapy. So the first advice is to breathe and do your research, right? And of course, that's when a lot of friends and people that you didn't think you even knew are coming in to tell you, oh, you should do this, you should do that, right? So that adds to the confusion. And then you have Mrs. Google, and I think Google is a lady because she just knows too much, right? So you have Google, and then there's more confusion. It's sort of like going to a health food store and deciding what vitamin C to use when you have like 20 or more options. So the first thing is to do your research, right? And no matter how much research you do, however, you can't get all the answers, right? Because science and cancer oncology doesn't have all the answers. So get to the point where you're comfortable with the research you've done, and then I insist to look at those 7 key principles, because to have an optimal outcome, you need to follow those 7 key principles. There's many choices out there, and oftentimes, especially believers, some Christian people, they say, oh, we'll let God take care of it, and they come to the clinic with a huge tumor in their breast that, I kid you not, is the size of a small watermelon, right? So, yes, we have to have faith. We have to think positive, work on our emotional baggage, which we all carry stuff, but we have to be proactive, right? And so in that proactivity is the research, and then ultimately making a gut or spirit-filled decision. Because, even in the first class of medical school, the first thing they teach you is the doctor-patient relationship, right? If you don't trust your doctor, then no matter what he gives you, he or she gives you, it's not going to have the best outcome or benefits. So find a doctor that you trust, find a doctor that you have that same energy, that listens to you. Oftentimes as physicians, we don't want to listen, we just want to talk, right? So listen to our patients and see where they're coming from, what their experiences are with, because now everybody has a story of someone that they know that did this or did that for cancer therapy. And so it's put the onus on the doctor to listen and to answer your question. So I'm not sure, Scott, if I truly answered your question, but it's to be calm, do your research, find a doctor you trust, and work on those, fulfilling those 7 key principles.